Alright everyone, I was watching The Rational National, as you do, and David started talking about something that's been on my list of things I've been meaning to make a video about for a while now. So let's get started with that clip from The Rational National.
This one I find really interesting. So they say most expect taxes to increase, deductibles and copays to continue under both Medicare for all and under a public option. So percent who say each of the following would happen under a national health plan, sometimes called Medicare for all. So the green one here. I want you to focus on this one in particular. So people would continue to pay deductibles and copays when they use healthcare services. 61% of people think under a Medicare for all system that you would still have to pay deductibles and copays under under Medicare for all. Why? No, you don't. But Americans have been indoctrinated to this system, this private for-profit healthcare system where they can't even imagine a world where they were able to just walk into, a doctor's office and walk out without having to do anything else, without having to pay an insurance company, without having to pay afterwards, or that process is eliminated completely under a Medicare for all system. But Americans are so used to their current system that they can't even imagine not having to pay for anything. But also, same goes for the question here about individuals and employers would continue to pay health insurance premiums. 44%, almost half of people think that you would still have to pay health insurance premiums under a Medicare for all system. Again, showing you how people have been stuck in a certain way of thinking, and it's hard for them to get out of it, which often goes to inform or misinform their opinions on these various issues.
Alright, David bringing that up was the perfect excuse for me to talk about this, because I reckon I can shed some light onto why Americans think that you still have to pay deductibles and co-pays and premiums under a Medicare for all system. Well, you know how the US has their version of Medicare for people over the age of 65? Well, I had a look at that website, and it appears that they've set this up to pretty much function in a very similar way to private health insurance. And so these poor bastards definitely don't know any better, because if they hear Medicare for all and they just think this system is going to be expanded so it's this sort of Medicare for all Americans, then yeah, totally makes sense that most of them think that they're still going to have to pay premiums and deductibles and all that. So yeah, I've had this on my list of videos to make because I mainly wanted to bring awareness to this, because I'm not sure how many people outside the US know about this mess here. Because look what they're asking people over the age of 65 to pay. How the hell? It's insane to ask that from anyone of any age. So yeah, this video was to kind of respond to David and also bring awareness to this and what the US's attempt at Medicare for people over the age of 65 looks like. For my American viewers, this isn't what Bernie Sanders wants. I'm pretty sure he wanted to bring you more in line with my country and David's country. Thanks for watching.